My name is Matsiele Repuno. I'm the Clinical Project Manager for LTE Medical Solutions. Okay, today in the Northern Cape, we will be addressed by the Deputy President of the Republic of South Africa, and we're going to have an event at one of the schools in Berkeley West where the whole community will be accommodated and be screened for TB. Okay, the International TB from WHO this year, it's Invest in TB, Save Lives. LTE as a company, we are investing in TB by providing the Department of Health with a mobile X-ray unit, which is equipped with a digital X-ray machine, with CAT, which is computer-aided detection, and CAT is supported by Q. The software is Cure AI. The software reads all the images that are done for the day. It will identify abnormal X-rays and normal X-rays. The abnormal X-rays will be sent for GXP for further evaluation to diagnose the people and to start treatment whenever they have to be started for treatment. We are offering them X-rays today, digital X-rays. As you know, that digital X-rays are one of the tools that can be used for TB screening purposes. Everyone will be X-rayed using a digital X-ray and CAD. It's because of its accuracy. TB, it's TB, and if it's in the lungs and it's been there for some time, it will be shown immediately. One other reason that it is used is that it's very efficient, it's quick and cost-effective as well. As we know now that we are not using any chemicals, everything is digital, and the images are done within a few seconds. Mobile solutions are very good in that they go to the communities. Patients are followed, or clients are followed wherever they are. They don't wait to be sick. We take the services to the doorstep of the communities, regardless of where they are. We can reach rural areas, we can reach urban areas, we can reach suburban areas. Anywhere we are able to get there and provide services to where the people are.
My name is Kingshuk Mishra. I lead global health programs for Cure.ai. At Cure, we built a X-ray screening solution which we call as QXR. QXR is able to look at a chest X-ray for signs of pulmonary tuberculosis. QXR seamlessly fits into the workflow of the radiologist. Once a patient at the screening camp has been registered for an X-ray, the X-ray is acquired within a few seconds, and the X-ray that has been acquired is sent to the AI, which then screens for signs of tuberculosis within 30 seconds. It's quite simple to integrate Cure solution with any kind of radiology workflow. So we have solutions which can go into fixed clinics or mobile clinics. We can work with places where there is steady internet connection, and which will be offered by our cloud platform. And we can also work with an offline solution which we call as QBox, which is essentially a mini computer that can fit into a fixed or a mobile clinic, which can operate without the need of a steady internet connection. So having worked with frontline workers over the past 5 years, we have heavily invested into TB. So with this year's theme in mind, which is Invest in TB, Save Lives by the WHO, our solution can not just look at signs of pulmonary tuberculosis on a chest X-ray, but we can go far beyond. We can look for lung cancer, COVID-19, COPD, signs of heart failure also from chest X-rays. So we can not just look at tuberculosis as one of the things on an X-ray, we can look at overall lung health as well. With Cure's QXR solution, we can fit in seamlessly into the workflow of the radiologist. So with QXR, once a patient has been registered at the screening camp, he can then be forwarded for the X-ray requirement. So once the X-ray has been acquired, the AI will look into the X-ray, and within 30 seconds, it will give the analysis whether the person who has been screened is presenting signs of pulmonary tuberculosis. And with this AI, we have been able to bridge the gap between diagnosis and treatment, because Once the person has been screened for possible signs of tuberculosis on the chest X-ray, he can then be further mobilized for GeneXpert test, which is like the molecular test for signs of tuberculosis from sputum.
So with Cure AI, the advantages and betterment is that images are reported immediately. As we know that globally, we have a shortage of radiologists. People wait for a long time for their x-rays to be read, and which delays them from getting their treatment sometimes. We all know that chest radiography is the last on the reporting for radiologists. But with Cure for AI, it's read immediately. So it fits perfectly into the patient workflow. NE purposes, because of links, what we're using, we're able to report immediately. This is a chest x-ray that was done. The report of the x-ray is there immediately. And we can also update whether sputum has been taken. When the results come, that can also be updated. And also that somebody has been started on treatment. All that information, it's there in real time.